a spiel to read out, which makes it all right and proper. Can I welcome you all to North Tyneside's Health and Wellbeing Board? My name is Councillor Margaret Hall. I'm Chair of the Board. This meeting is being streamed live on Council's YouTube channel to enable members of the press and public to observe the meeting, and I welcome anyone who is watching. Before we move into the agenda, I would first like to make it clear who is participating in the meeting and explain how we intend to conduct the meeting. In order to check who is in the meeting, I would like to ask everyone present to confirm their attendance at the meeting. In order to do this, I shall call out the names of the members of the board. After I call your name, please turn on your microphone and camera and introduce yourself so that ensure that you can be seen and heard. It would also be very convenient if you could say which organisation you are from or representing. That would be most useful. So I now go, it feels a bit like a teacher at registration. Councillor Muriel Green.
Hello, present and correct. Hello to everybody and welcome, same as Margaret. So we'll have a very good meeting, Margaret. Thank you.
Councillor Matt Wilson.
Hi, yes, I'm here, Chair.
Nice to see you. Councillor Tommy Mulvenna.
You can hear us.
We can.
Oh, now you should be able to see us. Well, hopefully.
Unfortunately, we can't, but we can hear you. And if you can hear us.
Councillor Tommy Mulvenna, North Tyneside Council, Hollywood.
Thank you. Councillor Karen Clark.
Yes, thank you, Margaret. Councillor Karen Clark, Long Benton Ward. Thank you.
Thank you. Wendy Burke.
Hello, I'm Wendy Burke and I'm Director of Public Health. Thank you, Chair.
Thank you. Jackie Old. Is she?
No, I don't think
Right.
Jackie's with us at the moment.
Okay. Richard Scott. Dr. Scott? No. Right. Leslie Young Murphy.
Hello, Chair. Yeah, Leslie Young Murphy. I'm the Exec Director of Nursing and Chief Operating Officer at North Tyneside CCG.
Right. Thank you, Leslie.
Thank you.
Judy Scott.
Hello, I'm Judy Scott, Chair of Health Watch North Tyneside.
Thank you. Paul Jones.
Afternoon, everybody. Hello, Paul Jones, Director of Health Watch North Tyneside.
Thank you. Christine Briggs.
No, I don't think Christine's with us.
Maria Miller. No. Claire Riley. I know she's with us. Claire.
Hi, Margaret. Claire Riley, Executive Director of Communications and Corporate Affairs for Northumbria Healthcare.
Lovely, thank you. Peter Kale. No, I can't see KK.
Yeah. Chair.
Yes.
I understand Denise Cowans is representing.
Oh, from yes, right. Thank you.
Denise
Cowans, are you there?
Hello, Denise Cowans here, representing Cador Cawley from Cumbria, Northumberland, Tyne and Wear.
Thank you. I attended your annual meeting yesterday. It was very interesting. Thank you.
I hope it was. Thank you.
Very. Susanna Thompson.
Hello, hi, I'm Susanna Thompson, GP and Medical Director of Tyne Health Federation.
Hello, Susanna. Yeah. Craig Armstrong.
No, I don't think Craig's with us.
Ian Warren.
Good afternoon, everyone. Ian Warren, Head of Prevention and Education for Tyne and Wear Fire and Rescue Service.
Lovely, you're most welcome. Dawn McNally.
Good afternoon, everybody. Dawn McNally, Group Chief Executive at Age UK North Tyneside. Thank you.
Thank you. Andy Watson. No. Cheryl Gavin. Yes, she is. Sharon Gavin.
Hi everyone, I'm Cheryl Gavin. I'm the Director of Helix Arts and representing the community and voluntary sector.
Hello, yes.
Hi, yeah, thanks.
Dean Titterton.
Yes, Dean Titterton here, Chief Exec of the YMCA, but also representing children and young people across the borough.
Lovely, thank you. I have Susie Cook.
Hi, I'm Susie Cook, Public Health Registrar. Thanks for having me.
And you're an observer to the meeting. Thank you. Anya Paradis. Yes, Anya.
Hello there. I'm Anya Paradis and I'm Director of Commissioning and Performance at North Tyneside CCG. Hello.
Hello. Do you know, it's lovely seeing you all again. It seems so long. Well, it is so long, isn't it? Is there anybody I have missed off?
Apologies. Scott Woodhouse from North Tyneside Council.
Scott Woodhouse. Lovely. Michael Robson is the officer running this meeting. I also I'll keep to the script. Also present online with me are the following officers who are not members of the board but have joined the meeting to support and advise the board. I will invite them to introduce themselves. Officers, after I call your name, please turn on your microphone and camera and introduce yourself. Scott Woodhouse.
Good afternoon, everybody. Scott Woodhouse, Commissioner Lead for Adults within the local authority.
Lovely. Thank you very much, Scott. And Michael Robson.
Yeah, afternoon, everyone. Michael Robson, clerk of the board.
Lovely. We also have a number of other officers joining the meeting to provide technical support and cover in the event of connections being lost. To ensure that the meeting runs smoothly, can I remind participants to please turn off your microphone and camera when you're not speaking. Only speak when invited to do so by me, and activate your microphone and camera before speaking. If you please state your name before speaking. If any member or officer wishes to speak, please use the hand raise button or alternatively the chat facility. If referring to any specific points in a report, please specify the page number, and if any participant connection to the meeting is lost, I shall adjourn the meeting for a short period of time to allow the connection to be restored. I would probably need a little bit of support for that, Michael. And I think that is the script of that I have to read out. Anyway, it was lovely seeing you all. And I now begin the meeting, the business of on the agenda. And first of all, Chairman's announcement. Please allow me to have a little bit longer in announcements because of the tremendous experiences we've been having. North Tyneside, along with 6 other North East local authorities, are in a form of lockdown from midnight tonight. I have no doubt you all know that. At this meeting are the key people involved in the COVID-19 in North Tyneside. I must thank you for joining the meeting, and you are all most welcome. And I did wonder if there would be some apologies, but great, you've all come. What an incredible time we've had since the last meeting of the Health and Wellbeing Board. March 2020 brought us a new and difficult situation called COVID-19. We are in the middle of a pandemic which has a long way to go yet. This meeting is to consider the way to take forward the Health and Wellbeing Board and make it fit for the future. We need to have a working plan that reflects the demands required of our organisations. At this meeting are representatives from all the major organisations that have played a large and are playing a large part in dealing with the pandemic. Residents of North Tyneside are lucky to have such a group of people who have demonstrated flexibility and commitment throughout this difficult time. Praise rests on the shoulders of our super workers, those who treated our very ill residents, who nursed our sick, cared for our elderly, transported the very ill, and supported those who needed help to get food, prescriptions, and information. I have observed leisure officers working for the food bank, staff working over and above everything asked of them in places where they are most needed. And of course, people working from home, which is not always easy with family members in the office. Shop assistants and bus drivers came up to the mark, and we have seen great kindnesses and small gestures of help given by many. I want to add this tribute to you all by thanking Wendy Burke and her team for their work in steering us through these difficult times. It is not over yet, but we are very much more confident now, and we know what we have to do. I would now invite members of the board and anyone watching our proceedings to join me in a minute's silence in memory of those who have unfortunately lost their lives as a result of the coronavirus pandemic. 1 minute silence. Thank you very much for that. Now, to move to the agenda, have we any apologies for absence?
Yes, Chair. We received apologies from Richard Scott, Richie Rickaby and Kadar Kale.
Lovely.
Would you like me to go on to the substitute members?
Yes,
we'll
please.
have Ian Warren is joined the meeting on behalf of Richie Rickaby from Tyne Fire and Rescue Service, and Denise Cowans, as was explained, representing Kadar Kale from Cumbria, Northumberland, Tyne NHS Trust.
No, thank you. Any declarations of interest and dispensations? There being none, can I move to the minutes of the meeting held on the 9th of January and for confirmation of those minutes? Agreed?
Agreed.
Chair, agreed.
Thank you. Move now to item number 6. This is the main item of business that we have to consider today to relate to how we move forward in the context of COVID-19. The board rightly did not meet during the emergency of the pandemic to enable key... All right?
Cheers, bye.
The board rightly did not meet during the emergency phase of the pandemic to enable key officers and board members to focus their attention on the urgent response to the COVID-19 outbreak. Now that the immediate emergency phase has come to an end, it is now time for the board to play its part in providing shared leadership and ensuring there is an integrated strategic approach to the recovery plans. To help us do that, to inform our deliberations, we are now going to have a presentation from Wendy Burke, Leslie Young-Murphy and Paul Jones, in which they are going to outline the impact of COVID-19 and the emergency recovery plans and the health and wellbeing priorities. And of course, believe it or not, there have been opportunities which have arisen from the emergency. So can I invite those three to do their presentation? Thank you very much.
Chair, thank you very much. It's Wendy Burke here. I'm going to be kicking off. We're going to do a joint presentation, so we've worked on this together. So I'm going to start, and then I'm going to seamlessly hand over to Leslie, who is then going to take over from me, and then we'll hand over to Paul Jones for the end bit. So we've broken it up into 3 sections. We're going to start with a bit about the experience and the impact in the response phase to the pandemic. Leslie is going to talk a bit about recovery, and then Paul Jones is going to talk about the work that they've done throughout the period, and some of the key messages and issues that they've picked up from members of the public that they've worked with over the period of time, which will give some implications for us going forward. So that's how we're going to address it. I first of all just want to start by thanking you for your initial words, Chair, at the beginning, and also your vote of thanks to both myself and the team. That's really welcome. I think I just want to echo some of the things that you've said. I think for many of us, particularly professionals in the room, the pandemic is something that none of us really expected to have to deal with, this points in our career. And I think although we've had pandemics in the past, I don't think that we've ever witnessed one that's had such far-reaching impacts. So without further ado, I'm going to try and share my screen. We've got a backup plan. If I get thrown off Teams, Michael does have the presentation, and I'm sure Leslie will step into my shoes and take over the presentation. So here we go. We'll try and share it.
Thank you.
So I'm hoping that you can see that.
Yes.
Okay, brilliant. Okay. So we're going to start with some of the epidemiology in terms of just some of the facts and figures that we've got, having looked back over the period, just to demonstrate the kind of impact that the pandemic has had on the borough of North Tyneside. And the first thing we're going to start with is the epidemic curve and the number of positive cases that we've seen across the course of the pandemic in North Tyneside. So it's a really lovely example of quite a beautiful epidemic curve for those of you who like epidemiology. And it shows that very initial peak, kind of late April into May, when we were at the height of the pandemic and where we saw a great deal of cases in North Tyneside. You'll note that towards the end of May, those cases started to tail off. As a result of all of the lockdown measures and particularly the infection prevention and control measures. And over the course of the summer, the rates and the cases in North Tyneside stayed relatively low up until the mid towards the end of August, when you can see we've started to see another rise. And, you can see that we were headed for another peak. It has tailed off in kind of recent days, but that rise to that peak, that second sort of peak, is what has resulted in further local interventions that the chair referred to at the beginning. So that's what the number of positive cases looks like. That's what our curve looks like, and this is our current day situation. The 7-day infection rate per 100,000 population is currently sitting at 44.25. When we were back in August, that rate was down to 1.6, I think, at its very lowest. So from the beginning of August, you can see the kind of rise in the 7-day infection rate that we've had from about 1.6 right up to 44.25. And to provide a bit of context, that rate is still relatively low compared to other regions. We've got other areas in the northeast that have got rates that are much higher, significantly higher, that have been up to very recently as high as 100 per 100,000 population. And again, as I said, that is the rationale for the current measures that are being announced today. In terms of what that looks like geographically across the borough, in terms of the cumulative number of cases, and the cumulative number of cases to date has been 1,188. It's spread right across the borough, as you could see, and you would expect with an infection like this for there to be greater numbers in our areas that are highly populated, and that is indeed the case across the borough. That we know with COVID-19 that there is a link with underlying vulnerabilities and socioeconomic deprivation and Black and minority ethnic status. And we certainly see some of those patterns in North Tyneside in terms of just looking at the preponderance of cases, particularly along the river in North Shields and Wallsend. That's what the age sex breakdown looks like. And you can see, you know, nearly we're getting close to nearly double the number of positive tests in females to males. We know that females are much more likely to come forward for testing, and the age picture is mixed. Although if we looked at the last 2 months of the age sex distribution, we'd see a very different picture to what we saw in March. That was largely because we were testing older people in care homes and in hospitals at the start of the pandemic, and now we are testing the whole population, and we know that the transmission currently is in the 18 to 35 age group. So we have seen a difference in that age sex distribution as time has gone on, but that's what it looks like in totality. In terms of the testing, this graph just tells us how much testing we've done over the course of the pandemic, and you can see back to the start in March where testing wasn't available across the whole population, that it was restricted to care homes and people who were admitted to hospital. You can see how the access to testing has increased and the availability of testing. The total number of tests done in North Tyneside to date is 56,000. In the last 14 days, we've tested nearly 10,000 people in the borough. And while that is very welcome, we know that that remains a challenge. In terms of deaths, so the picture of deaths again across the pandemic, we've had 159 deaths where COVID-19 is mentioned on the death certificate. The bulk of those deaths happened in the early weeks. Again, over the period of June, July and August, we've seen very, very few deaths. In fact, of late, I think we've only had one, which is very welcome. So a lot of people will say, oh, only 159 deaths, but every one of those deaths is somebody that belongs to a family, and it remains a tragedy. 93 of the 159 deaths happened in hospital, and 62 of those occurred in care homes. Of course, we know the COVID deaths that happened in hospitals may well have been care home residents as well. So that is it's a bit of a misleading statistic, but that's what deaths look like. And it's really welcome that the deaths tailed off and that we were able to protect our more vulnerable people in the borough. In terms of excess deaths, the picture looks good at the moment. Again, in the height of the pandemic, we had excess death rates higher than the 5-year average, as did most other local authority areas. Fortunately, we're back below the 5-year average excess death rate, which is very good, apart from in the last week. In terms of hospital admissions, again, the picture around hospital admissions very much follows the epidemic curve, with the bulk of hospital admissions being seen in that initial peak. And these are admissions to both Northumbria Healthcare Trust as well as Newcastle Hospital Trust. And again, following nicely the epidemic curve. What we haven't seen is a rise this graph certainly doesn't show a rise in recent hospital admissions, although we know from colleagues working in both trusts that there has been an increase in activity in both trusts, and I'm sure that representatives of both Northumbria and Newcastle will want to comment on that. While the transmission is happening in the younger age groups currently, we know with high levels of community transmission at the minute, we know that that is likely to spread across the age range, as it has done in other countries, particularly in France. They had a similar picture, and it did eventually impact upon hospital admissions, and particularly because of the impact on older and more vulnerable people. A similar picture in terms of discharges, again, following the same epidemic curve across both trusts. I won't dwell on that. In terms of critical bed capacity available throughout the pandemic, the capacity, the available number of beds available and those that were occupied, you can see from the graph. So the occupied is the light blue line, and the number of available beds is the dark blue line. And you can see really throughout the whole of the pandemic, this was managed exceptionally well by our colleagues in acute trusts, and we had good availability throughout the pandemic, which is really welcome. And you can see that from the graph. Again, in terms of ventilation beds, that same sort of shape, and the initial peak where the bulk of the demand was for ventilation beds. Again, that tailed off very quickly towards end of May and early June, and we haven't seen the demand for that since. But again, we're a bit worried about what that might look like going forward, particularly with the winter, and I know that Leslie will touch upon that in a moment. So that's the data, that's the picture that it paints, and it brings us up to date now. But in terms of the impact, I think we are all aware of both the social and the economic impact across the borough, not only locally for us in North Tyneside, but regionally and nationally. And we know that this is going to be something that will take us a long time to recover from. We've seen a new role for the state, both at a national and local level, in terms of systems leadership. The economic impact is huge, and I think we still don't realise just exactly what that impact has been. It'll be a little bit of time yet before we can assess that more accurately. But we know that 95% of our businesses were affected, and 28% of the workforce being furloughed. And there is a predicted reduction in GDP of up to 10%. But, you know, it's all of those lost opportunities, particularly in relation to innovation and technology. We know the social impact has been great. We know that COVID has impacted and increased our health and social inequalities. It's impacted on the poorest in society, and it will lead to a change in demand for social care going forward. And again, Leslie will touch on some of that. So basically, in a nutshell, what we're saying is that the health impact has been well beyond the virus, and including both mental and physical well-being. And I think some of what we learned has shifted a number of patterns for us, both on an individual and an organisational basis. And again, because of those patterns of both investment activity, how we work, how we consume, we just can't assume that we'll be able to, or we'll want to, revert to what it was like previously. So in terms of individuals and economy in North Tyneside, there were 27 nearly 28,000 residents on the job retention scheme, which equates to about 21.5% of our working age population. That comes to an end in October, and we are expecting a number of redundancies. We've already had some firms that have announced those. So the number of residents claiming universal credit increased to almost 18,000 in July compared to 11,000 in March. So we've seen an increase in 7,000 claimants. And we know that around 8,500 claimants are searching or trying to find work. Again, that's That's up by over 3,000 people from the March figure. Business rates collection to the authority is down by just over 12%. And again, the majority of businesses relate to offices and industrial businesses. And of course, it's affected business startups. So, you know, that ability to innovate and create new businesses has been hampered. And we've seen that that's decreased by a third. And we know that there's just not the job opportunities, that they're down by nearly a quarter. So a massive impact economically, not only in the pockets of individuals, but also across our economy in terms of our businesses. So the impact, North Tyneside Council. So during the course of the pandemic, we continued a lot of our services. We continued to empty the bins. We managed the cleanliness in towns. We provided regulatory services to keep people safe. Obviously, children's and adult social care were kept going. Public health services to children, and our schools remained open throughout the pandemic for particularly for key workers when we were in the height, and also for vulnerable children. We had to pause a number of services, so a number of the services that the council offered were impacted. So libraries, sports and leisure, household waste recycling, car parks, public toilets, crematoria, they all closed, some of them more permanently than others, and most of them have now reopened. And we had to cancel a number of significant events for the borough, particularly events that would bring in a financial stream for the council. VA Day went ahead, but it went ahead virtually, although, you know, it did happen in many streets across the borough. So, you know, a big impact on council services. And although we managed to keep some going, it did have a massive impact on others that we weren't able to provide. In terms of North Tyneside CCG and the NHS partners, core and urgent and emergency services will continue to be delivered throughout. And again, a bit like the council, identifying vulnerable patients and making sure that their medical needs were catered for. Rapidly and safely discharging medically fit patients from hospital was really important to make sure that there was sufficient bed capacity for those who were ill, particularly with COVID. The ability to postpone and divert the planned care that needed to happen to free up that capacity, creating extra critical care capacity for those people, particularly who needed ventilation. And again, just like all partners, deploying new ways of working, which was particularly relevant for our primary care colleagues, and using technology. We worked with the CCG to create additional community beds, and also a huge amount of support to both nursing and residential homes, and in terms of trying to cocoon the most vulnerable in our society that reside in those homes. And obviously the CCG, together with the council, was monitoring the COVID numbers, the spread and the deaths all the way along the line, and just thinking about the risks and the controls that needed to be put in place. So in terms of what went well, because I think your point, Chair, was that some things did go well, and you're absolutely right, they did. And the things that went well were that we, as partners, we had really clear strategic objectives. So not only did the council have those, but the CCG, health partners, other partners across the borough, and we were working together to try and deliver those very clear strategic objectives. Consistent communication, particularly of the public health advice, providing the COVID-19 support hub and helpline, and together with the NHS volunteer scheme to make sure that vulnerable people were supported. And I think the pandemic has demonstrated just how strong the partnerships are in North Tyneside, and actually some of those barriers that often get in the way when we're in the business as usual mode just seem to disappear. And you know, it was really welcome just to see how the whole system was able to come together and work as one for the benefit of residents and patients. Technology and working from home worked exceptionally well. I know, like the CCG and NHS colleagues managed to very quickly get people out of you know, their normal workplace accommodation where they could, and get them working from home very rapidly. Bed capacity within the NHS and discharges went very well. And again, across every organisation, redeployment of staff and that flexible approach. And we've got some really lovely examples of how we redeployed staff and how we came together as a system. And I think the care homes is a really good example of that, of pulling together a prevent and protect team, both across the council, the CCG and input from the trust to make sure that we could provide that support for care homes. And obviously providing a huge amount of financial support to residents and businesses. And just to remind you, they were largely the strategic objectives across the borough, and they were shared largely between the CCG and the council, and most of those objectives could be seen reflected in the partnership arrangements, whether that was in the ICP meetings or in the LRF meetings. And they were about leadership, they were about following national guidance so that it was easy for residents, reflecting the current context in North Tyneside so that residents were clear what the picture was and how we would stop the spread of the virus, protecting our most vulnerable, protecting our staff, and making sure that we had essential services delivered to the residents of the borough and patients where required. I'm going to pause there, thankfully, and I'm now going to hand over to Leslie, and Leslie's going to take you through the next phase that we're in, which is recovery. Leslie, over to you.
Okay, thanks very much, Wendy. Yes, so our plan and assumptions, which I think is our next slide. Are you going to click the slides, Wendy?
Leslie, just bear with me. For some reason, it's frozen.
It's frozen.
Oh, there we are.
There.
Right.
Great.
Okay.
Okay.
Right,
Lovely.
yeah.
Yes, thank you. So I think everybody's aware that COVID-19 will be with us for the foreseeable future, and therefore as a system, but also as residents, we need to be able to adapt so that we can live well with the virus. And I know that's a tall order, and we need to bear that in mind as we're looking at it, how we stand up services and how we get our messages out to the public. We know that a second wave of infections may coincide with flu season, and as we're looking at the moment, that looks highly likely. And also as we step into winter, which traditionally, as we know, across health and social care, can often be a challenging time for all services, as well as residents. We know that we need to work together to continue to safeguard and protect those individuals who've got significant health conditions, because we know that they will remain vulnerable until we have a vaccine, which at the moment appears to be some time off. We also know that we need to ensure that those individuals who have got confirmed cases need to remain in isolation, as well as their contacts until they've been tested. And we've consistently got those messages out, obviously led by Wendy and her team, but I don't think really we can say it often enough. Some of the key messages still seem to be not necessarily heard by all members of our population, in terms of the real importance of social distancing, good hand hygiene and respiratory hygiene, and how that will play a key role in how we protect the residents of our borough. And as you know, the most recent phrase is hands, face and space. And I think it's really nice and it's accessible. And I think the more we can get that out and remind people, the better. I think the key challenges as partners across the system, across health, social care, statutory and voluntary community organisations, is that there will be a change in nature of demand for services, based on what's happened to people during COVID, but also based on the fact that we've had to step down a number of our services, particularly in health, in terms of some of the planned activity that we now need to work together to step up. And I have to say, our hospitals are doing a phenomenal job. We're very lucky to be where we are in the North East. We also heard from Wendy in terms of the financial and economic and social impact for individuals and businesses. And in fairness, I think whilst we've got the early indications of that, in terms of their individuals' health and well-being, who's been caught up in that, we're just starting to see the beginning of that, which will also create additional demand on services. In terms of our strategic objectives, when doing the. Oh, sorry. Sorry, Wendy.
Sorry, Leslie, I'm struggling to get it to move again.
Don't worry, I'll just keep going.
There we go. There we go.
Oh, you got it right. I'll keep going. I know it. So in terms of our collective strategic objectives is to make sure that we deliver in line with our North Tyneside plan and the phase 3 recovery plan of NHS England and NHSI, which all of the health system is working to. We'll continue with our calm and resilient leadership to work together to make sure that we mitigate the impacts on the organisations, communities and also the economy. I think the other key thing is that we collectively will continue to follow government guidance in all that we do and make sure that we've got a good response and remain COVID secure throughout. We've already demonstrated that we'll have the flexibility and the response to respond to quite often a rapidly changing evidence-based climate to make sure that we're making decisions that's grounded in evidence and best practice. We'll continue to work to protect the vulnerable as a priority, and we'll have a collective responsibility in terms of how we do that. Our challenge at the moment is making sure that everyone who is eligible for a flu vaccine takes up that offer, and we're working across the system to make that happen across health and social care. Hospitals are playing a huge part, as well as GP practices in this, school nurses and others who have been reallocated to try and cope with the additional demand for this year. And throughout, whatever we do, we know the challenges in terms of the inequalities that COVID-19 has compounded. We need to continue to make sure that we promote physical and mental well-being, as well as address those inequalities as we are standing up our services together. So in terms of our health and well-being priorities for North Tyneside, one of our key things is to make sure that we accelerate the return to near normal levels of non-COVID health services and safely restore the hospital activity. I have to say, on our patch, we have done really well, thanks to the dedication of the staff, that we are already in a number of services back to pre-COVID rates. In terms of some of the planned activity, those are the various services that were stood down during COVID. We've all got recovery plans across the system. We're working together to prepare for winter and making sure that we are able to respond appropriately to any further COVID spikes, which Wendy's just started to talk about, as well as any other national requirements. We've had a lot of questions in terms of cancer referrals and treatments, and our commitment is to make sure we deliver the 2-week waits for cancer referrals and treatments. And we're really pleased to see that certainly Northumbria at the moment is delivering that, and there's a good plan in terms of Newcastle in relation to recovering to 90% of the pre-COVID responses. So in many ways, we're doing better than many places nationally. We'll continue to make sure that we have the right safeguards in place in terms of safety netting around our most clinically vulnerable patients, and that will have care coordination for those people whose care may have been delayed, and that there's regular contact with that. And I think our hospitals, both our FTs and our mental health trusts, have been really proactive in terms of how they do that, and we'll continue to make sure that's the case. From a national point of view, we've been nationally required to restore continuing healthcare assessments effective from the 1st of September. For many people, you'll be aware that as part of facilitating hospital discharge programme, both health and social care, rather than undertake the collective assessments that we usually do, as well as the independent financial assessments if it happens to be social care, have worked together just to make sure that things are coded under a COVID block. But the recent guidance is that we need to start doing that. So there's a huge backlog of that. Now, all of the patients who would have ordinarily been assessed during that COVID period would have received a letter from the discharge team to say that they'll be assessed in due course. And again, we'll work in partnership with the local authority to make sure these are done in an effective, timely way. Our GP practice access, have you continued to use their existing systems? We were very fortunate in North Tyneside. We'd already deployed a lot of technology to support our practices, and it really was quite a seamless step to maximise the use of that to triage patients where patients couldn't be seen face to face. I understand from a number of queries we've had whether or not face-to-face appointments are available again in GP practices, and the answer is yes. They've always been available, just not on every site. We are working with partners across the system in the ambulance service, the acute trusts and primary care to implement the Talk Before You Walk 111 service, which is really important in terms of making sure that people understand who they can contact to make sure they get to the right place at the right time and are seen in the most timely way. And that will help to prevent people going to various points of call where actually their care could be better delivered elsewhere. We've also enhanced access to primary care. We continue to have a hot hub, which is led by Tyne Health. We continue to have extended access, again, which is part of Tyne Health to supplement the additional GP practice services. And people are probably aware we've also got enhanced access to primary care through Livy, which is video consultations via GPs. Again, as part of a pilot to try and see how we can together respond to the demand for GP contact to make sure that we can get the right care in the right time in the right place to preserve the system from an urgent and emergency care for those people who need it. I'm going to hand over to Paul.
Thank you, Leslie, and thank you, everybody. I'm just going to talk you through some of the key kind of themes and issues that we've been hearing from local people. And this is based on the feedback that we at Healthwatch has gathered, as well as what other volunteering community sector organisations have shared with us as well. And we're really grateful to our partners for sharing that information with us, many of whom are around the meeting this afternoon as well. We as an organisation have heard from over 800 people, and talking to those other organisations, well, I think we've got a reasonably good representation of what people's experiences and understanding of what people's experiences have been during this difficult time. I think it's most important to start with a thank you. I think people have and they talk to us all the time about the incredible support and pride they have for the NHS and the key services and the way that people have responded and the way that services have changed, and they really understand and get the importance of that very difficult period over between March and July time, and that kind of message about protecting the NHS really did hit home. So people have been incredibly complimentary about that. About that experience, and thanking individuals for their incredible hard work and support. So well done, everybody. There are some things that we can obviously learn from these experiences over time, and kind of think about how these might kind of need to be played out into the future should similar situations emerge. It is really complicated because some people have had some incredibly positive experiences, others less so. And I think it's hard to kind of think back as expectations of services have kind of changed over time. And I think we've seen an increase in kind of frustration as some of the kind of more kind of economic pubs opening again, restaurants opening again, and things like that, kind of those services kind of opened up, but people didn't see a massive change, or said that to us that they didn't see a massive change in the kind of NHS and care services that they were able to access at that point in time. So there was a little bit of a kind of a disconnect that was what was going on between the wider society and what people's expectations were of public services at that particular point. I think one of the key things that has come out of this, though, is an issue around knowing what services are available, how to access them and where to access up-to-date information. And I think this has been a real challenge for residents, for patients and professionals as well, particularly in that first few weeks when there was a significant change in services, and it was quite hard to kind of unpick and to understand to what was going on. And we did something on our website, a service changes information hub, that was incredibly well received. But I think there continues to be a significant gap in that kind of easy to access, up-to-date information about where people can get real-time information about what's going on, what services are available, both in terms of health services, care services, and voluntary sector organisations as well. There's some work going on at the minute in responding to this, particularly around kind of reviewing and updating and significant changes to the sign network, which partners around the table around this meeting are involved with, which hopefully, should the funding be permitted, be forthcoming, will enable a much better platform, a much more easy to use, easy to access platform about information about health and care services, voluntary sector information and things like that, which will be useful both for professionals who are trying to signpost and support people to access the services they want, as well as for people to kind of access themselves and hopefully become a really good kind of community platform that's owned collectively across the borough. And we've kind of seen this in the kind of build on, and we're trying to build on the kind of opportunities around volunteering. I think Wendy mentioned the NHS volunteers and the Good Neighbour volunteers that have come through Voda and the Council Support Hub, and we're wanting to kind of build on those opportunities to help spread messages and share and connect communities across the borough. That community spirit has been incredibly evident, and I think people are talking to their neighbours and their friends. They've turned to each other to help each other out, and that is an amazing thing. And that real sense of communities coming together and helping themselves and helping each other, I think is outstanding. People have been incredibly complimentary about the North Tyneside Council's local support hub and the work of Voda's Good Neighbours project, along with the many other kind of local support schemes that are available, the different organisations were providing to support people, particularly at the height of the pandemic, at the height of lockdown. But there's ongoing work going on there to continue that support and to help people to adjust to kind of the new normal. In terms of some of the things that are kind of people are talking about kind of more like public service directly, testing is a real challenge at the moment. I think everybody recognises that. We had some really positive feedback about the system as it expanded and be introduced over the months, but I think the last few weeks have seen a real issue for people. An ongoing concern has been for people trying to access tests who don't have a car, because a lot of the services have been car-based services you need to drive through them. And I know Wendy and the team have been doing some hard work across the board to try and get increased access for people who don't have access to cars. Could we move on to the next slide, please, Wendy? Thank you. So some of the really interesting stuff that's been happening is that shift from predominantly face-to-face appointments, and as Leslie kind of talked about, the CCG and others have done a lot of work over the time to kind of think about those different ways and done quite a lot of preparation to think about different ways that patients and service users can engage with services, particularly with GPs, if we're honest. But the pandemic caused a real shift in the way people access services, and phone and video appointments for GPs and outpatients have been worked really well for many people. So I think we get lots of really positive feedback. People are telling us that they're able to access healthcare that they wouldn't have been able to access in the past because they would have found it hard to get an appointment. So there seems to be a shift for many people about in a really positive way that sees that kind of increased use of phone and video appointments has. But for others, it is a real issue and a concern, and we've seen an increase, as I've said, over time, particularly as the kind of lockdown restrictions eased, around frustration about not being able to have more face-to-face appointments where it's appropriate. And we've done a lot of work with the CCG and others to understand what people want to see from their GP appointments in the future, about that kind of real mix of services that they want to see. They want to see a better mix of being able to access things either remotely by phone or by video appointments and face-to-face appointments, but to have more opportunity for patient choice to be kind of recognised in the future, so that they can escalate and they can say, actually, I do want to come in to see somebody face-to-face, recognising that during the pandemic it's been really difficult because of infection control, etc. But actually, there is a better balance to be struck at some point in the future about how those services are provided into the longer term, because I don't think we would want to lose some of that increased access that phone and video appointments actually gives to people in the future. In terms of making better use of the technology, similarly, people have told us that actually they feel a lot less isolated now than they have done. They're able to connect because everybody's now using Zoom or whatever, Skype and FaceTime and what have you. They'd be speaking to their friends and family more than they ever would have done. So for some people, this is really kind of changed that kind of isolation point. But for lots of other people, they are feeling more disconnected and more isolated than previously. As I've said before, some people prefer to have some medical appointments via phone. There's some interesting stuff emerging about a power relationship, the power dynamic, by people having not having to kind of go into a medical situation or an office to have an appointment, and people actually feel that it's a much more even relationship between a professional and the service user in that kind of way. But what we have been identifying is that there are lots of people who don't have access to technology in the way that we'd want them to, if they want to kind of make full use of these services in the future. So they either don't have the kit, the laptops, tablets, computers, etc. They don't have the know-how, so they don't have the confidence or know how to use the kit that they've got, or they don't have access to data, be it Wi-Fi or credit on their phones or whatever it may be, to make best use of their online services. So we are really concerned that of that data, of that kind of digital exclusion, that gap continues. And I know that service providers are really do understand and remind them about that, about the need to have both to continue to have services that everybody can access and works for everybody, including those people who don't have access to technology. But there has been some really good coordinated response work going on with the voluntary sector in particular, with VODA, AGK North Tyneside, the CAB and ourselves, looking at how we can kind of pull together to understand what the gaps are, think about what the response could look like to making sure that digital issue is addressed as quickly as possible. And I know there's conversations going on with North Tyneside Council at the moment to try and create a better, more coherent strategy that works for trying to get everybody on board to make best use of the technology that's available. Wendy, could you flip over, please? In terms of treatments and availabilities and delays and things like that, I think it's really interesting to see that people have told us that for some people who've been waiting for procedures, have told us they've been concerned that they haven't been kept informed, particularly well informed about the delays or when they can expect their treatments, and we'll provide some direct feedback to some of the service providers about some of those issues. But I think there's a really interesting thing to say about making sure that people who are waiting for treatment are kept very well informed about what's happening, and are kept in touch, and that they are supported with any ongoing issues that they may have. So if it's pain management, if they're waiting for a hip replacement or whatever it may be, that there is that good support there, because we're hearing from some people that hasn't been as good as it should be. That is a particular issue. There's been some frustration that some GPs and some hospitals had stopped providing some services whilst others appeared to be providing similar. This is all about perceptions, isn't it? But whilst other similar services appeared to be going on. So there's some things around B12 injections at the height of all of this, and pain management and pain relief and that kind of thing that probably just needs to be thought about in terms of ironed out and make sure that the comms is better into the future. I think it's really important to recognise the kind of massive impact that delays have on the quality of people's lives. We've heard some quite difficult story, people managing an awful lot of pain, some people saying that they're not feeling particularly well supported with that pain management, particularly whilst then waiting to access services, and that kind of ongoing care for some hasn't been quite what we'd like it to be into the future. And for some, dental treatment has continued to be a significant concern. If you've ever had toothache, you know how all-invasive it is in terms of your ability to think and things like that. So actually, thinking about the dental treatment, I think has had a significant impact on people's lives. And I think the kind of key lesson is around regular communications, ongoing support, and making sure what people can do and they can what services they can access whilst waiting to access other things. Transport continues to be highlighted, particularly over the last few weeks and months, the last couple of months, continues to be those travelling to hospitals, people unwilling to use public transport, and we've seen some of the kind of in some of the conversations around the new restrictions coming in tonight about use of public transport. So there is a real concern about using public transport to access health services, and then the pressure that puts on people to then either rely on friends, which will be an issue now, because you'll not be able to kind of access, use the support of others in quite the way that they might have done recently, but also how people get to different hospital facilities as well. So there's some things about transport which we've talked about as a board in the past, and I think continues to raise a concern. And people telling us, particularly around the increasing use of their fund money to have to pay for private taxis to access transport as well. That said, an awful lot of people have really appreciated not having to travel to hospitals for outpatient appointments because they're able to access things online through Attend Anywhere services or through telephones as well. So there's a really interesting mix of that kind of transport needs as well. Just finally, Wendy, on the kind of my last slide, as we've been doing a lot of work with North Tyneside Carers Centre to understand the impact that all of this is having on carers, and I think there's been reference to a change in need and call upon social care services. And certainly carers have been saying to us that they've taken on more responsibility and they felt the need to protect their loved ones. So they haven't asked for help and support from social services or other services. They've kind of managed it themselves within their kind of family networks and things like that. They're also talking to us about the significant mental and physical well-being impacts of that role within their lives, and that some of the problems that they've experienced have been the same problems that they've always had, but it's been more so brought on by the pandemic. So access to respite and things like that weren't available at various different points has been a real issue and concern. I think we forget, or we risk forgetting, or we might not always think about the importance of day services and school services, and how that kind of provides an integral part of the support that are available for the individuals and also their families and carers. And whilst those services were closed, that put a massive impact on those particular family units. And I think we've heard from people, particularly parent carers and users of day services, that they didn't feel particularly well supported whilst those services were closed and kind of left to get on with it and kind of manage things particularly themselves. And we've heard some very difficult stories from people, from carers who don't live with loved ones, weren't able to visit them during the height of the lockdown, and that kind of when visiting was restricted and what have you, to really understand kind of what's happening there, and that feeling of responsibility and guilt about what is happening to their loved one, but they're not able to do anything about it. And I think that's a real sense for carers in particular that we shouldn't forget. We've heard some stories about PPE, particularly the early days of the virus, that have been shared with the council and others as well. And we're starting to pick up some stuff about self-funders. I think people who are funding their own social care in particular, so that be that care homes or people coming in for domiciliary care and things like that, have talked to us how they found it particularly difficult to understand what the PPE requirements were, what support was available to them. They haven't necessarily always got a social worker, so they don't have that kind of support that was available to many through North Tyneside's adult social care services. In quite that way, they aren't quite as plugged into those services. So that there is a particular set of needs there that I think are really interesting for us to understand further, and we're doing some more work at that at the moment. Mental health, as we talked about, has been a real issue around anxiety, sense of loss of control, particularly and mental well-being. And we've heard some concerns around access to IAPT, particularly after a very prompt initial assessment, but some delays further on into the processes as well. I'll stop now. There's lots and lots of feedback that we'll be sharing with providers and the Future Care Board in much more detail than this. So many really positive stories as well about people going well out of their way to provide one-to-one support and care, and to make sure that people were kind of getting the access to the support they needed and the help that they needed at various different points and what have you. As you know, with Health Watch, it's always difficult for us to find that balance, because people generally talk to us if they've had a problem or if they've got a concern that they want to raise. So, but we've had some incredibly positive stories about the excellent work that's been done by teams as well. So, thank you very much.
Thank you. Thank all three for your very, very good presentation. It's funny, you know what's gone on, and none of that was brand new, but very, very good to have it presented in one piece, and very helpful to let you understand exactly what has happened, what is going on. I'm going to ask for any questions, for any comments, or for any observations. Could you please show your hand? Signal, and I will try, maybe with the help of Michael, to make sure everybody gets heard. Thank you. I think I saw Muriel Green first there. Sorry. Karen.
Yes, that's me coming up now. Sorry. Is that okay? Right. Yeah. Honestly, absolutely tremendous. We've as councillors heard so much of this as we've gone on, but I've written down here everybody in the borough should have heard these presentations, because they are an example of how a group of mixed professionals and non-professionals have all risen to the occasion and the challenge of something which has been quite extraordinary throughout the world. And I just want to ask a couple of questions, because I hope those slides are available everywhere else. And I just wanted to ask what was the most difficult, if there were challenges that you faced and you couldn't do them, or what was the reason why you couldn't do them? Because there's been such a lot that has been done, and I am impressed by the proposals for the future, because I think it's an area where we all have to learn from everything. I think everybody, you know, we've sat back here for the last 6 months and almost been cosseted because we've not been professionals, we've not been out in the world doing the sort of work and meeting the challenges that you have. So I just wondered, for you, what were the most challenging things, and are there actually things which you have tried to do which for some reason haven't been able to, and why haven't you been able to? And that isn't meaning in a negative sense, because I think there are frustrations when you are trying to meet challenges that that everybody meets in every sort of challenges. But I really do think everybody in the whole borough, particularly at this point in time, when we see people walking about the streets of Newcastle as if it was, it was last summer, with no masks on, and we're not doing very well in that respect, and we have got all of these challenges. But what have been the most challenging things, and have there been things which you couldn't achieve or you would have liked to have done more about, please?
Can I suggest that those professionals at the meeting, if you indicated, if Muriel's asked a specific point there, and I think perhaps this is an opportunity for anybody to perhaps point out the things that were most difficult. Thank you. Anybody? Leslie?
Yes, thank you, Muriel. I think that's a fantastic question. I think we're very fortunate in North Tyneside across the organisations that we've got a number of people who are very pragmatic by nature and have a tendency for tenacity to get things done. Certainly from a health point of view, I can say two things that were really challenging, and I think that was the amount and sheer volume of guidance that was coming down through the COVID incident process, a very necessary process, but nonetheless, the COVID incident rooms in all of the trusts, in CCGs and local authorities, the LRF and up the line, I think the early days, the flurry, constant guidance, all of which that had to be read, all of which that had to be acted on and synthesized. So I think for that, I think we did find that challenge in early doors. I think the testing, and I know Wendy's talked about that before, in relation to, I think the majority of people across the system could see what a difference that would make early doors. So we did find that challenging. That said, I think really the rest, I think we've managed as a system to do things that we should all be really proud of, each and one of the staff that have been involved, and indeed the residents, because I think if a number of years ago you'd said that everybody would comply with the amount of restrictions that people have had on them, I don't think people would have believed it. So I think for a lot of people it's been that isolation that's been particularly challenging, and then making sure that we get services to respond to that.
Thank you.
Anybody else that wants to make a comment about the most difficult aspect of the last 6 months? Paul?
Thank you, Chair. And just a couple of things. I was trying to type them out in the message board, but I'll just say them. I think there's a couple of things that's emerged from us. One is around helping people, local people, residents, to understand what the guidance is, what services are available, how to access them, and things like that. There was so much information going around at the moment, but it wasn't always the easiest way easiest accessible way. So I think that was a real challenge at the time, and continues to be in some respects. Also, I think there's a really interesting thing for the voluntary sector about reaching people. And I've had a conversation with Dean, Cheryl, and Dawn and others about this, around how, because face-to-face activities haven't really been possible recently, or can be very limited, and obviously that's changing. So that means that you have a very different relationship with people. You don't feel that you feel that you can you're not reaching as many people as you should do. We know there are more people out there who might need support, who might need some advice, and might need to benefit from different services and things like that. But our reach, it seems to be a real challenge at the minute, and I know that we're doing some work collectively as kind of third sector leaders around how we can think about some of those issues and work better together to coordinate responses and share resources and things like that.
Thank you very much. Does anyone else want to make any comments in regard to Muriel's points?
Can I just come back very quickly? That's great. I can understand those are there seem to be national ones as well. I just wondered from any of the other people that are here with us, not just the Health Authority, whether anything from the other services, the ambulance service or the fire brigade or the pharmacy people. It seems to me things like dentistry and opticians must have actually, not being able to attend those. You've mentioned the dentistry, but the opticians as well must also have been challenges for people, and they don't seem to have sort of been raised as important health and well-being issues. But I just wondered if any of the other agencies other than the hospitals or the public health were able to make any comments.
I can't see any indication.
I'm happy to speak, Chair, from the fire service.
Pardon?
I'm happy to speak from the fire service, Ian Warren.
If you would, thank you.
Thank you for the opportunity. Probably our biggest challenge certainly came from my department as being prevention and education. Every single thing we do in our department is outward facing. So that's whether it be working with the young people, Prince's Trust, the Phoenix program, our cadets, Safety Works, where the children come into, all had to stop. But also with regards to our home safety checks, where obviously we're going out and visiting the most vulnerable in the community, we had to turn that right on its head because we couldn't cold call to obviously protect our staff, but also protect the community. So working with partners, we've mentioned the CCG, referrals, whether they come from, well, anyone. We basically visited, normally we would do the home safety check, go into the home. We turned it on its head. So we actually had a phone call triage, which included the health and safety check, the fire check, and also a health questionnaire. And then we determined whether we would go and visit. So we were still able to visit the most vulnerable in the community. We just had to do it in a totally different way. One of the big things that's hugely helped us was the change in regulations to do with sharing of data. Organisations were able to share data with each other, which enabled us to get to the most vulnerable. And we're hoping that that will continue because some of the guidance has been extended through to March next year. So my plea is let's keep sharing the data where appropriate, protecting the data so we can still help the most vulnerable in the community.
Thank you. That's a very good point. Yes, thank you.
Can I go to this now? Matt Wilson, you indicated.
Thank you, Chair. Well, thank you for those presentations. And the one thing that struck me as I was listening was, and this, I'm sorry if this is a really boring sort of comment to make. I just wanted to, well, for starters, commend Wendy and the wider team for essentially standing up a load of new structures that didn't exist back in January when we last met. And obviously all the extra workload that went along with that. But also, I'm not sure whether all the members of this board appreciate what all those new structures are. I'm sure many of them do, but I know I must have been back in, what's the date on this? Back in June, I was provided by a briefing note, and it had a kind of a really helpful sort of diagram on it of the relationship between all these different boards. At the top it got the Joint Biosecurity Centre, and then the Health and Wellbeing Board. I don't know if everybody on this board appreciates that we've now got a subgroup of this board called the COVID-19 Engagement Subgroup. We've got the Recovery Coordinating Group, the Health Protection Board, etc. So I thought maybe it's worth circulating this so everyone can see the different parts of the system and how they interrelate.
Right. Thank you for that comment.
I'm happy to do that, Chair.
Is it still up to date, Wendy, or does it need any tweaks?
I think it's been updated since that first iteration, Matt, but I'm very happy to circulate it round to the board. It lays out the arrangements for outbreak control and how it fits with the other arrangements in the borough. in terms of trying to protect the whole journey for recovery.
Thank you.
Great, thanks.
Karen, you indicated.
Yes, Margaret, thank you, Chair. Oopsie daisy, sorry, turned the camera off again. Just wanted to totally endorse the comments from Muriel in relation to thanking all of our fabulous service providers and communities out there who've all come together during this incredibly difficult, challenging time. I mean, it's really inspiring, I think, what people can do when we're up against it. And I really just want to extend thanks on behalf of, you know, certainly everybody. I just think it's been incredible. So I'm delighted to hear about all the progress that's being made. I do want to raise an issue about the Livy contract. I am aware we do have a representative from the CCG is going to come along to our informal adult social care subcommittee meeting on the 1st of October. So we will have an opportunity to discuss this in more detail there. But I did want to say, I know there's been some concerns about that contract raised by members, and I'll basically say what they are. There's been concerns, I think, around the process of awarding the contract, and a feeling that perhaps, you know, people could have been better informed or consulted. I think the nature of the contract, that it's a private sector organisation, concerns around the costs that are being paid for the service, and just questions around how it will work in general. So I'm conscious, Margaret, I will save that for the committee meeting, but I thought it would be remiss of me not to just raise those issues at this point because it was mentioned in the presentation. So thank you.
Okay, I'm really loath to go into this discussion. Leslie, I will allow just literally a comment because it will be going to the meeting on October the 1st.
Yeah,
Leslie?
no problem, Chair. Thank you very much. It'll be very brief. It's just to say that, yes, we welcome the opportunity to come along and have that discussion, and we are confident that we'll be able to satisfy members in terms of the points that we'll discuss there. That's all I want to say.
Okay, thank you very much for keeping that brief. Now, I think I'm going to ask Michael. JS, is that Judy Scott?
Yes, it is.
Thank you. You want to speak?
Yeah, I wonder if I could just clarify something that somebody raised with me this week. I understand that social care carers have priority for testing, for getting regular testing. And the person raised with me that their mother was in supported housing, and the carers there didn't seem to have priority for testing. And I wondered if somebody could just clarify that for me, please.
Margaret, I can clarify that.
Thank you.
Okay. So it isn't all social care workers, just to be clear. The people that have priority for testing are the care homes. So there is there's a whole programme of testing for care home residents and care home staff on a routine basis for whole home care testing, even if people are asymptomatic. And then in the instance where either staff or residents become symptomatic. That is a whole national programme. It's been established nationally and it is well established in the North Tyneside area, but it is just for care home residents and for care home staff. It does not apply to any other setting. Thank you.
Thank you. Thank you. Judy, that's...
Yeah. I suppose I just don't really understand why it couldn't extend to others.
Well, I think we have to take the answer that we've been given.
Margaret, I think my answer would be it's a national, the whole of the testing in the country is a national testing programme that has been procured by the government from a commercial partner. So all of the Pillar 2 testing, everything that happens outside of the NHS, is procured by the government from the private sector, and we have no control over that on a local basis. It's all done centrally, it's all operated centrally, and the care home programme is part of that national testing programme. So it's the way it is. It's been decided nationally, and unfortunately, we have very little say or control over it.
Yeah, and I think the headlines that we're constantly hearing at the moment are indicating there is something a little bit amiss with that service, but that's for another place to solve. Now I have indicated on the bottom AM.
I think that's Dawn, Chair.
Dawn, thank you, Dawn.
Thank you, Margaret.
Right.
Thank you. I'll just add my thanks to Wendy and everybody else. And as a leader myself, I feel incredibly proud to be part of our response to COVID-19. I'd just like to share some of the worries around older people, and some of the things have been picked up in the presentation. There was a point in the presentation around benefits, universal credit. I did just want to flag up that there's fewer older people that are accessing, certainly using us as an organisation to actually access unclaimed benefits or support to access benefits. The good news is, because everything I'm going to mention now, that we are actually working with people on a solution, but I do think it's important that we raise these issues that are impacting on older people. North Tyneside Council are talking to us through Councillor Pickard around potentially increasing our capacity and to be able to raise awareness of this issue through some funding through the Poverty Fund. All the way through the presentation, isolation and loneliness was raised. That's a big challenge for older people. It is impacting on mental health. And I just wanted to let people know that we have got some grant funding through Charitable Trust to increase the capacity there. So please use us for that. Most importantly, that we are finding older people, some of those conversations are really quite challenging, and we've had to increase the skill set of staff supporting people through that service. Older people are still wanting their shopping. There are half of the older people who are frightened to come out, so still want us to do their shopping and pick up prescriptions and the like. And Paul mentioned how the voluntary sector leaders are trying to come together to improve our response, because whilst we all have done, we've risen to the challenge, we don't want to be complacent and we want to respond better, especially with winter heading our way. And the other point to flag up was the whole move to digital. And we've been consulting with older people, and we know that, I'm just looking for my stat here, that over 70% of older people have got the internet, but they're only really using it for texting, FaceTiming, that kind of thing. There's very few people who are using it to access services. Thank you.
Thank you very much. I understand that completely. Paul, I have an indication from yourself. There are several hands up. Can I just check that if you want to speak, or you've just left them up? Judy, do you want to speak again? No?
No, sorry, I don't.
Muriel? Karen? Super. Then can I ask Paul, did you want to speak again?
Sorry, Chair, no, I'd left that up from last, I apologise.
Right. So I have an indication from Leslie.
Yes, thank you, Chair. I know Wendy talked and touched on care homes, nursing home and care homes, and I just think it's incumbent upon us all just to recognise the huge effort that the care homes and their staff have made to respond to the needs of the residents they've got, as well as the domiciliary social care providers. And I think obviously this latest peak, which has resulted in the reduction of visitors again, it's just to say that there'll be a number of partners across the system working to look at what we can do to support the care homes, as we have done before across health and social care and the voluntary sector, because we recognise that it is a challenge in terms of individuals feeling isolated and lonely. And we have, as part of the original response, deployed a number of electronic devices that allow support and FaceTime, and also support reminiscence therapy as well. But in fairness, that's no substitute for seeing somebody. So obviously we will work closely with them to support them across the system.
Thank you very much, Leslie. I have Dean, you've indicated.
Yes, thank you, Chair. We've spoken an awful lot about older people, but in terms of young people, I just wondered in terms of what coordinated effort was being done with schools. We obviously know that there's a spike and there's a difficulty in social distancing in schools, and we know that there is an intent that schools need to keep going for all the right reasons. But we're coming across a lot of young people that we're engaging with who I wouldn't say have got fear, but have misunderstanding and have conflicting views of what's right and what's wrong to do. So, and I know that some of the things are sometimes just basic housekeeping elements. It would be just good to know, and I'm sure schools are onto it, but is there a coordinated approach across the board?
Wendy, are you able to answer that? Because I know you've had one or two contacts with schools in the borough.
Yes, thank you, Margaret. Dean, just to give you some assurance, so the school improvement team and the service in North Tyneside Council, headed up by Diane Buckle and Jackie Old, have obviously done a huge amount of work together with my team across schools in preparation for full school reopening, but also over the last couple of weeks while the schools have gone back, just providing day-to-day support and being a point of contact for teachers around any concerns around any cases or any outbreaks. So there's been a lot of effort put into that, but equally there's also been effort put into what we support for pupils to kind of educate them about good infection prevention and control. We bought some resources for the primary setting in terms of hand hygiene, and we've also bought some resources for the secondary setting. In relation to mental health and wellbeing, Diane Buckle has a proposal to do a systematic approach to mental health first aid across all our schools in the borough, and we've got a plan for that through the mental health and wellbeing group that we've got in North Tyneside, and also in terms of our strategic alliance with Bernardo's. And obviously the Department of Health and Social Care have provided some funding to each local authority to particularly target mental health and wellbeing in schools. So there is a huge amount of effort going on. It remains a challenge, particularly for young people in schools where there's a case or an outbreak. No sooner have schools got back, and then we've had a significant number of pupils that have had to be excluded because they need to self-isolate because they've been a contact. And actually, we know that has a massive impact on the mental health and well-being. And then I think the last thing to say, Dean, is there's also something about particularly maybe the teenagers and the older teenagers, just thinking about what we can do in terms of reducing transmission as they edge towards kind of 17 and 18, and that younger age group as well, that older age group as well, we're seeing the transmission. So again, just thinking about innovative ways about how we get the messages across. So where the comms department are working with a theatre group at the Linskill Centre to see if we can get young people to come up with some engaging messages that might have more impact than me standing up in front of them and asking them to behave in a certain way. So a huge amount going on. Thank you, Chair.
Thank you very much, Wendy, for coming into that. I don't see any more hands indicated, so I'm going to Judy. That is by. You don't want to ask another question. You've just got your hand up, right? I'm going to move on to agenda number 7, which, Claire, do you wish to speak? Sorry. Hello, Claire?
No, I haven't put my hand up, Margaret.
Sorry, I don't know what's happening. It's probably me. We'll move to agenda number 7, which I introduced in my words, my introduction, is really what we want to look at in some detail today, because we're talking about the future. We're positive. It's no good just reflecting on the past and what could have done and what should have done, but the future is the most important. And I'm going to ask Wendy if she will introduce this report and take us through it. And I think you will then understand exactly what it is in health and well-being we want to achieve. Thank you very much, Wendy.
So, sorry, Margaret, I'm a bit thrown. I'm not sure what report you're talking about. I thought, is that the paper?
Yes, the paper.
I thought you were doing that. Forgive me.
Oh, okay. I'll take it through.
Is this the proposal for what the board does next? Apologies.
Yes.
Sorry. Maybe I'm happy to do that.
Right.
I haven't got the paper in front of me, so apologies. But I guess what you want the board to do, your ask as the chair, I think, keep me right, is that we now think about what the priorities for the board is and what we need to include in the work plan for the next 18 months or so.
Yes, that's exactly.
And I guess we need to think about what period of time we're thinking about. There was a suggestion that we might come up with a plan that would take us until the end of the current Health and Wellbeing Board strategy, which is 2023, or whether we just think a bit more short term and just think about the next year, because it's tricky times at the minute, and certainly COVID-19 is kind of in the forefront of everybody's mind, and it's certainly the focus of a lot of activity, but it shouldn't be the only thing that we focus on. So I guess it's just it's thinking about how we do that as a Health and Wellbeing Board and what the process might be.
Yes, thank you. I know the report is quite detailed. Do we need to go through for the information of it? Do we need to go through those points? I'll just ask members to have they read this report? Is it right? I'm not quite sure. Well, I'll take us through these. At the previous meeting, we agreed to establish a working group, which was to get a steer from chief officers and members as a priority for the board and formulate detailed proposals. These proposals are to be submitted to the board, were supposed to be submitted to the board for consideration on the 2nd of April. That meeting, of course, was delayed, and since then, of course, we've experienced the pandemic, and it still means that we have to look at the future and plan a work plan for the Health and Wellbeing Board. There are various, as outlined in the previous presentation, we have now got a clear picture of what's happening and what we hope to happen. The Health and Wellbeing Board now has a key role to play in providing shared leadership and ensuring there is an integrated strategic approach to the recovering stage. And what we want to do is to take account of as Wendy said there, the wider determinants. It's not all just it's not just all the pandemic. There is still the issues of what poverty and lifestyle, etc., does to people's long-term health needs. And of course, here the work, what's outlined here is the identification of any urgent and immediate corrective action that needs to take place, mindful of the lessons we've learned during the emergency period. And we do need to plan, as Wendy's just said there, for the future. To inform the board, we've had this joint presentation from the Council, the CCG and Health Watch, and it is proposed that a working group will be established to progress this work, and to formulate a draft work plan. And I think that's expected to come to a meeting of the board, which will be held on the 12th of November this year. Just say this year. So I think what I need to do now is ask if that has the agreement, the recommendation that given further consideration to the impact of COVID-19 in North Tyneside and the emergency recovery plans and health and wellbeing priorities, and determine the priorities and formulate a work plan for a board to be formed and to enable that work plan to be made and to be presented to the next meeting of the board, which is on the 12th of November. I do apologise for all that, but I think what we're requested here is to agree the formation of that working group, group to bring that piece of work back to the next meeting. Is that agreed?
Chair, I've got my hand up there.
Sorry, Muriel. Yeah.
Just to endorse what you've said, the thing about this, any good committee always has to review what it's doing, and we've had the plan so far for a number of years. There are some things where huge improvements have been made, and that's to be applauded, and perhaps we don't need to do so much about those, but there are one or two things that I've just already picked up from today. For example, the new we should be looking at the future from this. For example, I was really interested in the statistics about the digital use of, particularly by older people. And, you're quite right, some just use it for texting and this sort of stuff. But I do think there's a whole area there where the IT coming into health and social care and things really could be looked at right across the board from everything. Could be one of the things you added onto it. And the other thing that I thought was very interesting was about the sharing of data protection of data. And there are data protection things as well, but maybe that's something which I very much welcome and we've wanted to have for a long time. But I was also going to suggest that we actually ask if I could nominate Matt Wilson to be on the elected member on that board. We need to have a new pair of eyes, somebody who's not looked at it from the past, but somebody who can bring a fresh look at what we're doing. So I would like to nominate Matt, but thank you very much.
Thank you, Muriel. With those comments taken on board, can I ask that we agree the recommendation? Is that agreed? I'm not quite sure how that shows. Unless there's any objections, I'm going to take it that you all agree. Thank you very much. That does bring us to the end of the agenda. Thank you for bearing with me on this. It's all this new technology that which us older people are getting used to very quickly. Thank you. Matt, is that an indication to speak?
Yes, thank you, Chair. Well, just to assure other members of the meeting that Muriel's nomination there was not out of the blue, and I had previously been asked if I'd be willing to do that, which I am willing to do. So yes, I'm happy to serve in that way. Thank you.
Thank you very much. Then I bring this meeting to an end, and thank you all very much for your cooperation. Thank you. Bye-bye. I'm always have a cup of tea now.
You've urged it, Margaret.
Thank you, Margaret.
Well done.